Spine Institute, live stream spine surgery. Our patient presents to us with back pain. He comes from Idaho. He's had back pain for 5 years. He's had laminectomy already done. He has a huge scar. Laminectomy, unfortunately, does not treat back pain. A lot of people think laminectomy, discectomy treats back pain, but it does not. What treats back pain is identifying the source, where is it coming from, and treating the source. That's what we do here at Deuk Spine Institute. We identify the source and we treat it. Sean? In his case, he has pain coming from multiple areas. The first area the pain is coming from is the facet joints. There are 6 facet joints causing his back pain. L3-4, L4-5, L5-S1, and bilateral, meaning on both sides. Shot? What do you think about that, Jordan? Pretty darn close, huh? Now, why do facet joints cause back pain? The answer, simple, inflammation. Now, why do facet joints have inflammation? That's the real question, folks. And the answer is injury to the joint causes inflammation. So, let's take a look at how do facet joints cause pain.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. We've just looked at how facet joints get injured and cause pain. Next, we're going to look at how at Deuk Spine Institute we treat that pain using the most advanced technology in the world, which is plasma technology, to get rid of joint pain.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You've seen now on our videos how not only do facet joints get injured, they cause pain, but also how we fix that pain at Deuk Spine Institute using the latest technology, which is plasma technology. Now, this is not plasma that comes from your blood. This is plasma coming from the tip of a very important probe called an electrocautery probe. Shot. And that probe delivers high energy right to the exact spot where the pain nerve is. You guys see that on the x-ray there? Jordan is going to point to it. It's right where my tip is. That is the exact spot, Shot, where the pain nerve is. The pain nerve runs over that arch of bone. So we use the x-ray machine to find it. We use the plasma wand to cut it. The nerve we're cutting is not a nerve that goes down your leg. It's a pain nerve. It's called the medial branch of the dorsal ramus. Dr. B, blood pressure is perfect. We don't have no bleeding. Any questions for me about that?
No current questions.
Excellent. So in that case, I think while we're finishing up his Deuk plasma rhizotomy for his facet joints, we should show the audience the 60 different causes of 30 different causes of back pain. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. And welcome back. You can see from our video that we are basically treating the source of pain, and there are 30 very specific causes. They include discs. There are 5 that could cause pain. There are really 2 that cause 90% of the pain, L3-S1 and L4-5. There are facet joints that cause pain, typically L3-4, L4-5, L5-S1. And piriformis muscles can cause pain. Finally, sacroiliac joints can cause pain. So we can treat the source of pain as long as we know what it is. And Deuk Spine Institute, we have proprietary treatments for each of those sources of pain. All right, let's see. We got 5. Almost looks like he's got some transitional transverse process. 4, 3. I would say right about there. We're going to move on to the right side now. We've treated his left facets. We have not yet done his piriformis. That will be the next procedure we do. He has basically pain coming from these facet joints, L3-4, L4-5, L5-S1, and his piriformis muscles. He also has some SI joint pain, which I picked up on yesterday when I examined him in clinic. We talked about it. He doesn't feel the pain in the SI joints that bad, so he wants to wait and see how it does after this procedure. But definitely has bad facet joint pain, which we're treating today. We've watched the video on how we do that. We've also watched the video on the 30 different causes of back pain, chronic pain. Any questions from our audience?
We do. We have a question from Bob. Good morning.
Hi, Bob.
Can weight be a factor for disc herniated?
Can weight be a factor for disc herniations? The answer is no. In my opinion, no. There have never been definitive studies showing that weight causes back pain or disc issues. What really causes those disc issues is trauma. Typically trauma from sports or motor vehicle accident or a slip and fall. Those are the typical sources of trauma. The most common, obviously, would be some type of a sports injury. But trauma is required to have a disc injury. And as far as what makes a disc injury symptomatic, because that's a really good question. Why do so many people have disc injuries and they have no symptoms? The Japanese did a really good study, very eye-opening for me. They looked at 1,000 people off the street with no back pain, and basically they did an MRI scan on those 1,000 people. What they found was that out of 1,000 people with no pain at all, 90% had herniated discs. 90% of the people on the street walking around every day without back pain had herniated discs. And what it really showed was that herniated discs are very common. Lots of people have them, but they don't have symptoms. So what causes a herniated disc to cause symptoms? And the answer is inflammation. So why do, out of every 100 people with disc problems, why do only 10% have pain from those disc injuries? the answer is 10% have inflammation. That's why. But why do those 10% have inflammation? Nobody knows. That's a great question. It's one of the unsolved mysteries of modern medicine. So lots of people have disc injuries. Very few have symptoms from them. And the truth is, we do not treat people with disc injuries unless they have symptoms. Okay? There's no reason to treat somebody with a disc injury that has no symptoms. You can't make no symptoms better than no symptoms. The whole point of treating the disc injury is to get rid of symptoms. And if the patient doesn't have any symptoms, you don't want to treat them, because you can only make them worse. Okay? So, does obesity have anything to do with back pain? No. I've treated hundreds and hundreds of thousands of people with back pain. And I see back pain in fat people, super skinny people. I see it in normal people. Vast majority of people with chronic back pain are normal. They have a normal weight. They don't have any weight excess. They're just normal people. And I don't think weight has anything to do with back pain. Now, there is a correlation between being fat and having back pain, but it's not the correlation you might think. It's not the one that doctors may try to convince you of, that being fat causes back pain. It doesn't. It's actually the opposite. Having back pain causes you to be fat. Why is that? Because when your back is hurting you, every time you, well, we're not there yet. I want to do the last facet. Folks, when you are in pain all the time because your back's hurting, then you're going to end up having gaining weight because you're not active. Sean? Got to get this last pain nerve, medial branch of the dorsal ramus, L5, on the right. Very difficult to get to from where I went in. So I'm going to try to get to it from a different angle. Yeah, I don't know if that answers your question, but that's the God's honest truth. I don't think obesity is a cause of back pain. I think obesity is a result of back pain. And we got to stop thinking about back pain as being a disease of fat people. It's not. There are far more normal weight people and skinny people that have back pain than there are fat people. Okay? So the only thing is that back pain causes you to get fat because you don't do anything. You can't run, you can't exercise, you can't go out for a walk or a jog because you're hurting all the time. And all you want to do is lay down, sit down on the couch, and rest because it's hurting you so bad. So we have to stop demonizing fat people for having back pain. It's not their fault they're fat, and it's not their fault they're having back pain. They have an injury, and that injury is fixable if they come to the right doctor. Most doctors will tell you back pain's not curable. There's no way to cure back pain. It's not true, folks. We do it every day here at Deuk Spine. As long as you get the right diagnosis, you can get the right treatment. Sean? In his case, we're treating the facet and we're treating the piriformis. We need to also treat his SI joints, but he didn't want to. He wants to wait. All right? And I respect people's choice. As a doctor, my job is to treat people who want to be treated, not to force people to be treated. So I advise people, my patients, what I recommend. The rest is up to them. They have to decide for themselves if they want that treatment. Sean? All right. I'm just about done. His anatomy is such that it's difficult, Sean, to get to the last nerve here. His iliac bone is kind of blocking it. Sean? Sean?
Bob has a follow-up question. Doctor, what do you think about arthritis in the lower back?
I think arthritis in the lower back is the cause of back pain in 95% of people with chronic back pain. Then you can have arthritis in the facet, you can have arthritis in the disc, you can have arthritis in the SI joint, and those three causes are probably 98% of chronic back pain. All right, thanks for joining us. We'll be back in just a minute with our bilateral piriformis muscle release.